Lieu, GI medical oncologist from the University of Colorado. So when can patients with colorectal cancer avoid having an ostomy? When you look at colorectal cancer this year alone, there will be roughly 150,000 people diagnosed with colorectal cancer in the United States. And though the incidence of colorectal cancer in the older population is decreasing, and we believe that this is due to better screening and prevention, the incidence in younger individuals has actually been increasing for over 20 years. And we want all patients and physicians to be aware of this trend because this is typically not an age group that is screened for colorectal cancer with colonoscopies. If patients develop a localized colorectal cancer where the cancer has not spread to other organs, they may be eligible to receive a surgery for the cancer to remove it. So when we talk about an ostomy is simply where the bowel is redirected to the surface of the skin of the abdomen, and a colostomy bag is then used to collect the stool. So contrary to popular belief, about 80 to 90% of patients who have a surgery to remove a tumor from their colon or rectum will actually not need a permanent ostomy. The combination of advanced imaging technology and improved surgical techniques allows us to detect cancers earlier and remove them with more precision, often eliminating the need for a colostomy bag. Even for patients who do not need a permanent ileostomy due to the size or location of the tumor, for patients who do need a permanent ileostomy due to the size or location of their tumor, the setup shouldn't really stop them from doing what they love. And in most patients, it's actually unlikely to be very noticeable. But for colon cancer, it's really important to understand that it's rare that a patient will require a planned colostomy. And those that are actually at higher risk for an ostomy can include patients in poor general health prior to surgery, or if that surgery is done emergently, sometimes an ostomy is formed at that time. For patients who need a permanent ileostomy due to the size of their and location of the tumor, like I said, in most patients is unlikely to be noticeable. The biggest risk for a permanent ostomy is in patients with rectal cancer where the tumor is actually closer to the anal canal, and this is called a low-lying or low rectal cancer. Sphincter-sparing surgery is an advanced procedure in which we remove a tumor that is close to the anal canal without actually having to operate on that muscle, that sphincter. If a sphincter-sparing surgery can be performed, the need for a permanent ostomy can really be reduced. And so there's actually one study between 1990 and 2010 where up to 73% of the patients who had colorectal cancer did receive a sphincter-sparing surgery. And while this isn't a novel procedure, performing this approach really requires the expertise beyond general surgery. And therefore, these numbers are more favorable, actually, if you see a surgeon that specializes in rectal cancer surgery. Prior to performing the sphincter-sparing surgery procedure, doctors will first locate the tumor in relation to the line that separates the patient's rectum from the anus. If the tumor is close to that line and it's not growing into that muscle, the sphincter, the patient may be a candidate for surgery. The surgeon will then kind of disconnect the rectum from the anus, and they'll remove the tumor and that surrounding tissue, including the lymph nodes, and then the surgeon will then reconnect the colon to the top of the anal canal. And this actually avoids cutting into the muscle and eliminates the need for a permanent colostomy. Depending on the patient's anatomy and how much tissue is removed, sometimes a temporary ileostomy, so a temporary ostomy, is needed to allow the body to heal. These usually are there for about 6 weeks, and then after that, it can actually be reversed with a second surgery. One of the big take-home messages of this talk is to really seek care from a multidisciplinary team where you're meeting with the surgeon and the radiation oncologist and medical oncologist together at a center that has a lot of experience treating colorectal cancer. And this will ensure that you or your loved ones are receiving the best team-based care possible, and of course will lead to the best outcomes for the treatment of colorectal cancer. Thank you.